Research into skin disease, as well as awareness, is key in helping patients long-term, and that's at the heart of the British Skin Foundation's work. Their CEO, Matthew Patey, joins me now. Welcome, Matthew. There's growing understanding in the medical profession of the link between skin conditions and mental health, but that's not going to come as a surprise to the BSF, is it?
You're quite right, Marianne. What we found, especially over recent years, is that we're being approached by patients and also our supporters, not just for information and detail about the condition they suffer from and whether there's treatments, cures and so forth. More and more of them are approaching us regarding the kind of mental well-being and how they feel actually suffering from the condition. And also issues around confidence, especially going out. If you've got quite a visible condition, then that really does play on your mind.
You'd think that as a society, we would have perhaps moved past and been more tolerant, more understanding, more embracing of difference, and so some of that stigma around visible skin conditions would have reduced. But there's a great burden there still, isn't there?
We are constantly bombarded by imagery, on our phones, advertising, however that comes through to us. And more often than not, that is from an industry that kind of is promoting perfection. And there is no such thing as perfection. We need to almost say, like, the differences are the normality.
Of course, understanding and that kind of social acceptance of difference is key. So is the medical research that underpins progress. Tell us a little bit about that.
Well, at the British Skin Foundation, we raise money for skin disease research, but it's a two-pronged attack, because also the British Skin Foundation, we're very much aware that you can't just present cold research as research. You need to actually communicate what the skin disease is about as well.
And it's research not just about the pharmaceutical basis, the biological basis, it's the approach of treating the whole person, and it's not just a condition, is it? It's a person.
Yeah, exactly. I think certainly over recent years we've seen that, especially across the specialty and most medical specialties, it's not just about treating the condition. It's about looking at someone, not just a patient, but as a human being, as like you or me. And therefore, if they have a condition, yes, let's work on the physical side of that. Let's look for a treatment. Let's look for a cure. But at the same time, let's talk to them about how that condition affects them. How can we make them feel better out in the wide world? How can we give them more confidence to go out there and say, look, I had this condition, but you know what? It doesn't affect my life. I can lead a very normal life with it.
The BSF has been around for 25 years now. Tell us, in this anniversary year, what areas of skin research are you most optimistic about?
There's a lot of kind of work going into genetics, but also drug therapies, into all the skin diseases. So, you know, the well-known ones such as eczema, psoriasis, and skin cancer. Skin cancer is a major issue in the UK. And numbers are increasing year on year. The British Skin Foundation, yes, we can fund research into, you know, treatments and hopefully find some way of curing that. But skin cancer itself is kind of something you can do something about yourself. And there's a lot of information out there about how you can go about that. But for other conditions such as eczema and psoriasis, there are no cures at the moment. So we are funding research into those particular conditions. On the other side of the coin, we also fund research into lesser-known conditions, such as scarring alopecia, for instance.
Well, on the subject of alopecia, we caught up with consultant dermatologist Dr Christos Tziotzios.
Well, the British Skin Foundation has very kindly supported our research into the scarring form of alopecia, which is known as frontal fibrosing alopecia, which very, almost exclusively actually, affects post-menopausal women. Extremely common these days. Hair clinicians refer to it as a new hair epidemic. And these patients need early treatment with drugs that suppress the immune system in order to prevent the condition from destroying the hair follicles. So we're in the process of, we have started this relatively extensively for a number of years now. So we're the first group to identify the genetic basis of it. And some of these susceptibility factors can be translated into new treatments, hopefully with time.
It's an extraordinarily difficult time for some people, isn't it? Menopause, when so much is changing, to lose your hair as well is profoundly distressing.
Oh, definitely. Because, again, like the skin, hair and skin goes to the very core of who we are. It's almost like our identity. Yes, our personality is a big part of that, but again, the visible side of us is what people see. And so, especially for women, it can be very distressing to lose hair. And the thing is that this is becoming more and more common. There are hundreds of thousands of women out there, and men, who suffer from alopecia. So we're hoping that through our work, we can help at least them, but also in the future with hopefully some kind of cure or at least treatments that might be able to assist.
It's wonderful that the British Skin Foundation are there to support those researchers. Thank you for your time, Matthew.
Thank you.